Okay. Good morning. And we're going to discuss another topic. And this topic is for your practical skills. It's vital signs. Okay. So if you are working in the healthcare facility, you will be taking vital signs of your patients. So what is vital signs? Vital signs is a measurement. It measures your body temperature, your blood pressure, your pulse rate, or your heart rate, your respiration, and you can assess the pain, how the patient experienced the pain, and rate the pain, the quality of pain. And aside from that, if the patient is complaining with difficulty of breathing, then you have to take the oxygen saturation of your patient. And when the patient has a history, family history of diabetes mellitus, or the patient is having signs and symptoms like increased hunger, increased thirst, and increased um, urination, then you have to take the patient's capillary blood sugar, or we call that blood sugar level. Okay, so it means that vital signs is a measurement to confirm a health disease or a health status of the patient, or the health status or condition of the client or patient. Now, let us go to the vital signs. And first, we have to discuss body temperature. Okay, let me share with you the slide. Okay, so first is body temperature. So body temperature varies. Depends upon the patient's gender. Okay, because for female, there are hormonal changes, especially if the female is fertile and having menstrual flow. Okay, the temperature inside the body is higher. Now, how about the activities? When a person is working outside under the heat of the sun, the body temperature is high compared with those who are working inside the air-conditioned room. So it changes, depends upon the work condition, environment, and also gender. Now, let us know what is the normal body temperature. The normal body temperature ranges from 36.5 to 37.5 is still considered normal. Now let's go to the route. There are different routes in taking your body temperature. First is oral. Oral means you have to place the tip of your thermometer under your tongue, or we call this by mouth. But there are contraindications when you are taking body temperature through the mouth. First, a person who is unconscious, a person who has history of seizures, a person who have just eaten hot and cold drinks, a person who is sedated or disturbed, and a child who is under 5 years old. A patient who is being administered oxygen through mouth or nose, and someone who has surgery on the mouth and face, and someone who is paralyzed in one side of the body, or we can observe that to a stroke patient. So never use oral thermometer. The next route is rectal, or we call this through the anus. Now, this temperature is higher than the mouth. It's higher than 0.5 degrees Fahrenheit. And there are also contraindications when you are taking body temperature through the anus. A person having diarrhea, don't take temperature through the anus. A person who has rectal surgery, those who have hemorrhoids is the extra skin on the anus, and this is due to the overweight of the body, and also like pregnant women, because of the weight of the fetus, there is an extra skin coming out from the anus. And also those who are bearing too much weight, or their work is carrying heavy loads. Okay, so most likely they develop hemorrhoids. And those who have heart disease, because in our rectum, there is a nerve that once you've been stimulated, it will cause increased heart rate. The next is through the armpit, or we call this axilla. Temperatures that can be taken under the arm using a glass or digital thermometer tend to be lower compared those taken by mouth. And there are no special contraindications or considerations in taking the temperature through the armpit. You have just to clean the thermometer before using it. And after using it, you have to clean your thermometer. By ear or tympanic. This is a special thermometer that can quickly measure the temperature of the eardrum, which reflects the body's core temperature. How about by skin? A special thermometer can quickly measure the temperature of the skin in the forehead, and this is also used to check on infant skin-to-skin mattress. And this is very common during pandemic. Now, the second vital signs is pulse rate. The pulse rate is a measurement of the heart rate, or the number of times the heart beats per minute. So you have to measure the heart rate or the heartbeats in 1 minute or 60 seconds. Now, you don't only measure the heartbeat, but you also measure the heart rhythm and the strength of the pulse. The heart rhythm is what you hear, or you can hear in your stethoscope. Lub, dub, lub, dub. So that is a normal heart rhythm, or a regular heart rhythm. Now, the strength of the pulse can be weak, can be throbbing, can be strong. Okay, so this is measuring the strength of the pulse. It can be weak, it can be strong, or throbbing. Okay, so bounding, I mean, not throbbing, bounding. It can be bounding, it can be weak, or it can be strong. Okay. Next is the normal heart pulse rate in adult is 60 to 100 beats per minute. Now, for children, it's 70 to 120. And for infants, we have 80 to 160. Now, how to check your pulse? Using the first and second finger, you have to press firmly, gently on the arteries until you feel the pulse. So you can do that by yourself. This is the landmark. This is your thumb. You have to slide down. And in this area, you can feel the pulse. Then begin counting the pulse when the clock second hand is on the 12. Count your pulse for 60 seconds. When counting, do not watch the clock continuously, but you have to concentrate on the beats of your pulse. If you are unsure of your result, then ask another person to count for you. Let's go to respiration, or respiratory rate, or your breathing. Respiration rate is the number of breaths the person takes per minute. So the same, you have to count your breathing for 60 seconds or 1 full minute. Now, your rate involves the counting of breath for 1 minute. Make sure the person is relaxed or at rest. How many times your chest rises? So 1 rise, we call that inhalation. And when your chest falls, we call that exhalation. So 1 inhalation and 1 exhalation is 1 respiration. Now for adult, the normal respiratory rate is 12 to 20. Okay, 16 to 20, but 12 to 20 is acceptable. Okay, that is the normal range for respiratory rate. Children at more than 30 breaths per minute, and for infants, not more than 60 breaths per minute. Your blood pressure. Blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation of the heart. So when the blood is forced to your heart or the artery walls during contraction, we call that systolic. And the first beat that you can hear from your stethoscope. And when your heart relaxes, we call that diastolic. You can hear the last beat from your stethoscope. For adult, the normal blood pressure is 120, which is the systolic, and 80 is diastolic, mm per mercury. For children, the normal blood pressure is 110 over 80 mm per mercury. Now, there are kinds of blood pressure equipment. We have aneroid. This is manually operated. Digital is battery operated. Fingers and wrist blood pressure monitors are used by athletes to monitor their blood pressure, their heart rate during athletic activities. There are considerations in taking your blood pressure. First, don't smoke or drink coffee for 30 minutes before taking your blood pressure. So you have to let the patient, you ask the patient if she have just taken or took her coffee and smoke before coming to the facility. 30 minutes before taking your blood pressure. Then go to the bathroom to pee, before the test to empty your bladder. Then relax for 5 minutes before taking the measurement. And this is, it depends how far the patient walked. Sit with your back supported. Don't sit in a couch or soft chair, and never cross your leg. Place your arm in a solid flat surface like a table, with the upper part of the arm at heart level. Then place the middle in the middle of the cuff directly from the bend of your elbow. So this is the bend of your elbow. You have to wrap your cuff here, and you have to measure your 2 fingers. If it can go through, it means it's not too tight or loose. Then take the blood pressure at the same time each day or as your healthcare provider recommends. Record the date, the time, and blood pressure reading. So take the record with you to your next medical appointment. So if your blood pressure monitor has a built-in memory, so simply take the monitor with you to your next appointment. Then call your provider. If you have several high readings, don't be afraid of a single high blood pressure reading. Then you can take the blood pressure until 3 times, okay, with an interval of 1 minute. When your blood pressure reaches a systolic or the number of 180 or higher, and the bottom number is 110 or higher, then seek medical attention. Let's go to your blood sugar device, or we call the blood sugar level or your capillary blood glucose. Okay, the device used for taking your CBG, we call it glucometer. It's a machine used to monitor sugar in the blood. What is the normal sugar in the blood when the person is fasting for 8 hours? They're less than 100 mg per dl below. And if the person have just took her meals 2 hours before the test, the normal reading should be 140 below mg per dl. Now, there are tests for your blood sugar monitoring. First is fasting plasma glucose test. The doctor tests your blood sugar levels after fasting for 8 hours. And if it's higher than 126, then you have to confirm that diagnosis or the result. Because 126, this is now your borderline, or we call that a pre-diabetic stage. Now, for oral glucose tolerance test, you fast for 8 hours, then you get a special sugary drink. Now, after 2 hours, you have to submit for the test. And if it's higher than 200, then you have confirmed the diagnosis. Now, random check. This is anytime you can submit for the test. There is no preparation needed. And if the person is always peeing more, always thirsty, always hungry, and the blood pressure and the blood sugar is 200 and above, then you can do fasting sugar level test or glucose tolerance test to confirm the diagnosis. How to take your blood sugar. Okay, you have to wash your hands with soap and water. Wear your gloves because you will be in contact with blood. Then explain the procedure to your client, introduce yourself, prepare the equipment that you need or the machine. Now go to your client and ask if she just had take her meal or she is in fasting. Now, prepare your lancing device and you have to swab the fingertip of your patient with 70% alcohol. And fingertip is less painful and you can get an amount of blood. Then next is you have to prepare your pen or your lancet or your safety lancet, then prick at the fingertip of your patient. Then drop the first blood you have to discard first. Don't use it. The second drop of blood, you have to drop it on the strip and wait for 10 seconds and the result will just appear on the screen. Now we have oxygen saturation. This is to measure the fraction of oxygen saturated hemoglobin relative to the total hemoglobin in the blood. And the normal oxygen saturation is 95 to 100%. Now, what are the importance of oxygen saturation? Okay, so we have to continue. Sorry for the interruption of the lecture because of uh, the battery. Okay, so let us continue with the oxygen saturation. What are the importance why we have to take the patient's uh, oxygen saturation? Okay. To prevent hypoxemia. So what is hypoxemia? Hypoxemia is the low oxygen in the blood. Okay, so once your oxygen is going down, then the result of your oxygen saturation is low. And we call that hypoxemia. The next is to assess if the person needs oxygen in the blood. And next is to monitor blood levels for oxygen and patients undergoing surgery, and to assess blood levels with patients having heart and lung disease. Okay, so that ends our vital signs. And we have also pain. Okay, we have pain assessment tool, and this is numerical. Okay, 0, no pain, and the 10, worst possible pain. Okay, and for children who doesn't know how they experience pain, we show them faces. Okay, faces are smiling, faces are frowning, face that is crying. So a child will just point those faces. Then you can assess. There is numerical sign in each faces. So you can still rate the pain for children. Okay, so this is the lecture for vital signs, and you're going to have your practical skills on vital signs. Thank you very much and have a good day.